Guys, we're in the middle of the pandemic and these are trying times. It's hard on our mental health, our mental state, and this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, welcome back. We got my man, Dr. Sumon Chakrabarti. Yes, he is back in full effect. And let me tell you something. I've been excited about getting him back on and having this chat that we're going to have today because I feel like in Ontario, we're losing our minds, my friend. I feel like we're losing our mind. I think, you know, when we compare ourselves to some of the other areas in the world, I just feel like, what the heck is happening? So I must admit, I leaned on an ally. I got my boy Sumon to come on and comment on a few things. So Sumon, welcome back.
Thanks for having me. These balloons, by the way, are from a birthday party. So I hope they add some decoration here.
Some decorations. It's all decorations. One last plug, Solving Wellness. We just have a Facebook community now. Go to facebook.com/groups/Solving Wellness, where we're changing the boogie, reducing burnout amongst healthcare providers. And we're recruiting for our study, yo. So check out the links below. Okay, my friend, we are in a sixth wave. I want to get your impression on just your overall thoughts about this wave that we're going through at this time. Was it as expected? Was it better than expected? Like, what were your thoughts, Sumon?
Yeah, I'll say one thing. I mean, obviously, it's easy to speak in hindsight, but I will say that I was talking about this wave kind of like right at the foot of it when it was starting back in March at some point. I think that for those of us who've worked in the hospital during the winter and kind of the spring season, we know that we always have this kind of respiratory bump near the end of the winter, early spring. A lot of the time it's influenza B, and I'm talking before the pandemic. So the fact that we were having another bump wasn't totally surprising to me. It was a variant replacement this year again, kind of like last year went from wild type to alpha. And yes, it was alpha, not delta around this time when we had our third wave on top of the second wave. One of the toughest times that I think that we went through in the whole pandemic, seeing, first of all, the hospitals were overwhelmed, but then also just having like 30 and 40-year-olds sick on the ventilator. It was tough. This year, it was a very different story. I think that even though we had a ton of patients in December, we always see routinely that this kind of late bump, it tends to be smaller and certainly less severe is what we normally see in the wintertime. And that's what I was fully expecting to see. Obviously, I didn't have a crystal ball, and that's seemingly what we're seeing here. I think there were a lot of predictions that this would, outpace the fifth wave or whatever we just had. People were looking at the wastewater signals and extrapolating from that, which I think it doesn't make a lot of sense because it's two different viruses. But I think that overall, this was what I expected it to be, a wave that was there. It had some stress on the healthcare system, but nowhere near what we saw in the third wave, and certainly not close to the fifth wave that we had over the December, January period.
Yeah, I'm wondering if you could speak to the like severity of illness that you saw, because I mean, I get a bit of a one-sided, not one-sided. I get a biased view in the ICU. Like we get sheltered from a lot of the patients that might not be ICU candidates, but certainly what I saw was that the acuity was nowhere near the same. We weren't seeing nearly as many ventilated patients with classic COVID. In fact, most of the cases that we saw were incidental COVIDs. They came in for a different reason and they swapped positive for COVID-19. But, you have a broader landscape of what was going on. So what was your impression of the severity of disease?
Yeah, I agree, Kwadwo. This was like completely different. I mean, we were seeing mainly people that were coming into hospital. And it's hard to say whether it was incidental or the COVID was more of a catalyst. But for example, you would see an 85-year-old person, multiple comorbidities, often from a nursing home. And the COVID, what it did was it kind of just put them over the edge. They got a fever, they stopped eating, went into renal failure, falls, dehydration, that type of thing. But I will say one thing that was remarkable is that the people that we were seeing, that even I can't believe how many 90 plus year olds I saw in hospital, were this a year ago, it was a death sentence. And now you're seeing these people, maximum I've seen them getting on like maybe 3-4 liters. I saw one guy get on face mask. He's the first guy I've seen in a long time. And they were going home. They were getting better and they were going home. And, I think that I don't want anybody to get hospitalized. It sucks to get that sick. But the issue here, we can't ignore that the people who are getting hospitalized, a lot of them are fully vaccinated, but they're just very fragile medically. And it wouldn't make any difference if you give them a 6th, 7th, 8th dose. It was just a medically fragile person that even in that situation, we were able to kind of treat them and then get them home. So it's very, very different. And that's why it's important to not just look at the numbers. You have to look past the numbers and actually understand what we were seeing on the wards.
Yeah. I mean, even if I look back at this 5th wave, Sumon, it was predominantly, at least in the ICU population, immunocompromised folks or unvaccinated folks. And the immunocompromised were solid organ, like renal transplant predominantly. At one point, we were about 75% renal transplant patients in our ICU. Like, it was crazy. And so, yeah, it was just a different beast. We weren't seeing the 30, 40, 50-year-olds like we saw in previous waves. But yeah, it really... It felt different. Like, when you see a ward that would have an outbreak in previous waves, there'd be some people it would be fatal for some of the patients.
Oh, yeah.
And we weren't seeing really this in this 6th wave where people would, become sick during those outbreaks. So, this is, of course, there's exceptions. Of course, I'm not generalizing to everybody. I'm just saying from what I saw, this was completely a different beast.
Yeah. And I think we really can't stress how much different it was. Like, we were the same thing at Trillium, that the number of people in the ICU in the last, you can count on one hand people that actually had that classic, COVID hypoxia, bilateral, not whiteout, but, severe infiltrations, needing Airvo. We didn't have that. And, I think that we really have to remember that, not just with vaccination, but also people who have gotten COVID and gotten immunity from that, you now have a population that's no longer immune naive, plus a variant that is intrinsically less severe, especially in those with immunity. We have to really take that into consideration when looking at what's happening on the ground.
Yeah, and to reinforce that too, we were talking about, what do they say? At one point, they were saying like 100,000 infections per day kind of thing.
Yeah.
You know what I mean? When you look, 100,000 cases per day, and then you look what our hospitalizations were doing.
Yep.
Like, that was really reassuring in some ways. You know what I mean? Like, it didn't fit. It didn't fit what we were seeing in previous waves.
It's true. We have to remember that, like, I think that people, when you're kind of waves for us, especially for the first 3 or 4, they meant disruption to our lives. They meant restrictions, mainly restrictions. That was the biggest thing. And then you just have to remember that when you get a wave going through and you have a population that has so much immunity, that makes a difference. And this is how pandemics progress in the past. And you have to remember that immunity is something that is such a huge part of this and what helps us to get past this disruptive phase of the pandemic.
And to reinforce too, I don't know how much was said on the record for you, Sumon, but I know we've had some offline discussions. The the natural immunity and the hybrid immunity, how protective it truly was from severe disease. Like, I think this is what was really, and a less severe variant. Like, when you add it all up, this was like really positive, like really prepared us for this sixth wave. Like, knowing that, you hear different numbers for seroprevalence or how many patients or people have actually gotten positive from Omicron, the previous variants. But, like having that level of immunity, that hybrid immunity, vaccinations, like we really were in a good spot, relatively speaking.
I agree. And I'm in Peel, which is for a lot of the pandemic, we were at the very top in terms of incidence, just because, again, the structural factors, factories, multi-generational homes, dense population. And I don't know, I haven't checked as of today, but for the last several weeks, we've been right at the bottom in terms of incidence. Now, of course, some of that might be testing behavior, but also I just think there's a ton of immunity, whether it's like you mentioned, from the vaccine, from infection itself, or from both. And this cannot be ignored. And this is why we're in the situation we are now.
100%. And I mean, this gets a little bit to why many of us were advocating that we didn't need to escalate restrictions. We didn't need to escalate mandates and so forth. So I wonder if I could get your thoughts. Like, it was pretty heavy-handed, those that are wanting to bring back mask mandates. And I mean, you've been on the record saying, we're good. Like, we don't need to be adding more in terms of mandates and restrictions. Like, what are your thoughts on that? Like, what made you confident in that decision? How do you feel about what's being said even now today? Because there's still, in this spot we are in now, some hardcore enthusiasts saying, where's the mandates?
I hear you. No, to be fair, I wasn't confident or anything. Just that I thought, like, given the evidence that we were seeing in other parts of the world, like England, I think England's the great example, but also just kind of what I was seeing, that you look at different jurisdictions, so many places were trying restrictions, mask mandates, whether it's surgical masks, or, the N95 equivalents in places like Austria. They were all having the same thing, a wave. And, I was realizing that we didn't really have much control over the trajectory of the wave unless you were able to lock down an entire population. Then, for example, what we're seeing in China right now, right? But here, we're not really doing much to blunt the wave. And if you remember, in the first wave, the very first wave, it was one of our biggest ones. We didn't have a mask mandate, and it still ended up coming down. And I think the point is that these things kind of go up, they hit a number of the susceptible people, and they naturally come down. And it's been happening relatively quickly. So with that, you realize whether you masked or you didn't mask, it didn't make a difference. And I think that one really interesting quote that I heard from an article, I forgot where, maybe it was in The Atlantic, but the point is, at the very beginning of all of this, we had a strategy. And the strategy was, let's try to do whatever we can to break transmission chains, to keep community transmission low so we can reduce hospitalizations, right? The whole 2 weeks to flatten the curve. What ended up happening is the strategy became the goal. The strategy of keeping things suppressed became the goal. And it was very, very difficult to shake that even to this day. But I think the long and short of it is, I think before everything was dropped in February, I looked at this and thought, look, masks, I think on an individual level, if you're wearing a high quality, well-fit mask, it could protect you. Right. But on a population, by asking everybody to mask, it wasn't really blunting anything. So I think that's the reason why I thought it was time to lift the mask mandate. It was time to lift restrictions. And look, we had all of this at a time where everything was wide open. We had no mask mandate, and we're plummeting right now in terms of not just cases, but also hospitalizations. And I think that's what we need to consider going forward, that we're going to have more waves of this thing, just like we're just going to have respiratory season. I don't think that we should be reinstating any sort of mandate or restriction going forward.
Yeah. And I think we need to remember too, like, there's other, like, just next door in Quebec, didn't have an active mask mandate, and they had a similar wave of it as us, had higher numbers, in fact, per capita.
You mean they did have a mandate?
My bad. They had a mandate.
Yeah.
They had higher numbers per capita in terms of cases and hospitalizations. So, just as a real world example in terms of, seeing if we would expect a mask mandate to drastically impact our numbers. It's just, I feel like we just don't learn. Like, I feel like this is what gets on my nerves. It's like we have data in front of us and we somehow think maybe in Ontario, we're a little bit different. We can ignore what's happening next door. We can ignore what's happening in jolly old England, governor, like it's just, so yeah, I guess I just feel like it's kind of like we were talking about offline. This, like, I think we really need this perspective shift. I think, and I don't know how to create this. I keep trying to, like, the other day I was asked to do an interview and I remember talking to one of the colleagues and I'm like, I don't even feel like I need to address some of this stuff, man. Like we're beyond this now. Like, I want to talk about recovery. I want to talk about the path forward. I want to talk about how we catch our country back. I want to talk about how we get back to normal life. That's what I want to get on. Not like, oh man, this case number in this area went up. Like, I'm done. I'm done personally. Do you know what I'm saying?
I agree. And I completely agree with that. I think this is where this is an important thing is the last several months, we're talking about daily case counts, although daily case counts, they're still there. You can still access them, but they're not being kind of reported on every day. And my thing is that we're talking about the sixth wave now. There's going to be more waves, but we have to think about this. This is not numbers of waves anymore. These are not just respiratory season. When flu season starts, you hear the odd thing about it on TV, but the point is it's not something it's not benchmarked. It's not announced to everybody, which then kind of causes everybody to get nervous. Then we have a model come out and we have all this kind of like attention paid to what is essentially a respiratory season, right? So that's part of my thing, going forward is, we don't need to tell people when there's a respiratory wave coming. I think that's important to kind of people understand what they can do to stay, protect themselves if they choose to. And the other thing is the idea, it's kind of gotten into our lingo a bit, like, okay, you're saying, but stay safe, a long weekend's coming up, stay safe. And I don't even think that's necessary anymore. We don't need to be telling people to do things in order to try to decrease transmission. We don't need to do that. I mean, we can't. First of all, it's essentially impossible to stop the transmission of Omicron, given how contagious it is. Of course, in the hospital area, in other high risk areas, that's very different. I think it's important. I do like the idea of going forward with new buildings with good ventilation. That stuff all makes sense. But I think that the idea that you should be telling everybody, hey, it's May 2-4 coming up, be safe, be careful. I don't think we need to be doing that. And that just kind of always has this cloud over what we're doing. And I think that really affects people. It's like, you're having a good time, but that cloud's going to be there. It's going to come back. And really, I think going forward, in the next respiratory season, no mask mandate. You can have a recommendation and no need for restrictions because we've proven that look what happened with things wide open. And we lived through it. And I think this is what's going to happen in the future. But I still do think that we should control what we can control. And that's getting people vaccinated and boosted who are at high risk.
Absolutely. And I feel like we're wrecking people with this lack of, with this continuous fear narrative. Like I ran into a nurse the other day. She's got a 7 and 5-year-old. Both got COVID. And she was, I approached her. I'm like, are we shaking hands? Are we bumping fists? I wasn't sure. And she didn't want to do either. And she's like, I'm still nervous. I'm like, your family just went through COVID? And she was like, yeah, and they were fine. I know everything went. And she was like, I'm still nervous. I'm worried about getting COVID again and all these and all these kind of comments. I'm like, what is happening? It's like you're seeing people and, they've a month recovered from their COVID, no asymptomatic, still masking in public or whatever. And I'm like, what is it? Fear? Is it like, is it education? Is it like, want to show that you care? Whatever it is, we need to be, I don't know. I just feel like we need to be better. I just feel like we need to continue to move and shift that narrative of being like, going back to that normalcy, going back to that normal life, because all these limitations, restrictions, they impact people. Like another story, I remember hearing from a young teen girl saying, she was in an area, doesn't need her mask, but she wants to wear a mask because she could hide her face a little bit more, like to appear more attractive. I'm like, what the fuck are we doing to people?
I know.
You know what I'm saying?
Yeah.
Oh,
Yeah, it's terrible. And like, that's the thing that, these types of, social cues, facial expressions, just the idea of since the mask mandate dropped, there's some people that I've been working with, seeing as you're walking out of the hospital, I'm seeing their face for the very first time. And totally. It's refreshing. It's refreshing, but it's just, I realize that how long we've been in this. The hospital is going to be a different story. I'm not in any way, shape or form saying that we should stop doing that. It's a different circumstance, but outside there, it's been great this last 6 weeks without it. And just being able to go into a place, see people smiling, you're still seeing a lot of outdoor and indoor masking, but I know that as time goes on, that will decline.
Yeah. And just in case I get, the emails, I respect the individual choice. I just want you to make sure it's an educated choice and you're doing it to protect yourself when you feel like you need to be protected, not just for virtue signaling or whatever the term might be. It's a good question in the text box. Like, I'm trying to always preach, like, let's let the data support our policies and our decision making. And right now in this country, if you're unvaccinated, you can't go on a plane or train to visit your loved one. Like one of these things, these scenarios I heard about not that long ago is someone's loved one is dying and they want to get on a plane to go see them before their last days. Can't do it because they're unvaccinated. Any thoughts whether you feel like this is going to end or if it warrants further discussion?
Yeah, I think right now, especially now with the amount of immunity that we have on the ground, whether it's from the vaccine or from being infected, the idea of that, the small number of people who aren't vaccinated, I don't understand the reason for this coercion. First of all, I don't think coercion should be used at all for getting people to do a medical intervention. But I think that this sort of like hyper focus with so much kind of disdain rained down on people that haven't gotten vaccinated is troubling to me, especially just because it's not the way that I want to treat somebody. The idea that an unvaccinated person can't go on a plane, I think plane or a train, right?
Yeah, plane or train.
Any kind of that type of transportation, especially when we know the vaccine doesn't do a very good job of preventing transmission. So the risk, on a population scale is not really all that different. So I think it should have been lifted a long time ago. I think it is discriminatory. And yeah, it leads to these awful situations of people not being able to see their family. When if you remember that, if you're vaccinated and you have an unvaccinated person around you, you're protected against severe disease. If anything, if that person hasn't been exposed, they're at more risk, right? But now we're in a different stage. We're 2 years into this. People have even people who are unvaccinated, a large proportion of them have immunity from being infected. So I just think that all of these types of short-sighted policies should be lifted. Like you mentioned, going back to normal life, realizing COVID's now with us. We have tools to treat it. You don't ignore it, but that's something that we can deal with in the medical field. And for the most part, we've done a pretty good job, and the vaccine has done a great job in keeping people out of the hospital.
Yeah, absolutely. I do think overall that language, I think we did lose that narrative a little bit of like explaining to folks like the main value of the vaccine is to reduce your risk of being hospitalized too. I think this is one thing that got lost for sure. But this is something that, I feel like I'm continuing having to educate folks on. Got another question in the chat box. Would you go to a concert today without a mask?
Technically, yeah. I have. A concert. I went to the Raptors game. I've been a couple of times actually. In fact, I went to a Raptors game even before. You remember in October, November. Yeah. October, November, December. There's a period where things were wide open, right? Yeah. So I went to that. And I think that for me is that, listen, like I know that there's a risk of COVID there. Although to be fair, I think those of us who've been working in the hospital since 2020. I'm sure we've been exposed multiple times. Right? There's an interesting study that was looking at healthcare workers that had been exposed multiple times and then not gotten clinical COVID. I didn't get it until way later. But the point is that, look, I think that if you didn't know, if you didn't know it was COVID, it just felt like, having, I'm vaccinated. It felt like having just a febrile respiratory illness. Felt unwell for a day or two, and then I was back on my feet, right? And the thing is that knowing that it was COVID or not knowing, it wouldn't have made any big difference. So I think for me, it was important. I got to watch basketball. I love basketball. I got to watch a hockey game. Just being with my friends that I haven't seen in a long time. That to me was worth any small risk of COVID.
Yeah, I mean, I'll answer similar to you, Sumon. Like, I know my risks, and I'm not anxious for myself to get for a COVID infection. And if the times were different, if I were, immunocompromised, metabolically unhealthy, unvaccinated, it'd be a different story. But would embrace it at this stage. Like it's not 2020. I think that's to me what is lost in all of this, and not to be too repetitive, but it's not the same virus that it was, not only from a virulence perspective, but also from what it can do to us based on our excellent vaccination rates and so forth. I'm wondering, because this is a question I get a lot, is, who needs a fourth dose? Does everybody need a fourth dose? I don't know if you've had a lot of thought put into this, Sumon Chakrabarti.
Yeah. I don't know who does, to be honest with you, because I think the thing that's bothered me with the booster rollout, first of all, I think that when you're in an emergency phase, like we were, for example, in January 2021, you have to make calls without as much evidence as you'd like. And I think we did the right thing. We rolled out the vaccine to the highest risk people first. We went to certain neighborhoods as well, to certain FSAs where there's a lot of transmission. And I think that was the right call. Could we have done things better? For sure. I think we did that. Now that we're out of the emergency phase, I think that we really should be waiting for RCTs before doing any widespread vaccine policy. This fourth dose, I could see that it being given to, somebody who's profoundly, I think we've been saying immune compromised, but, having trained in ID, every one of them, we used to always harp on us. When you say immune compromised, what do you mean? Somebody who's on methotrexate is different than somebody who just got bone marrow, autologous bone marrow transplant, right? Or actually allogenic bone marrow transplant. It's a very, very different situation. So you have to kind of balance that. So, looking at what we're seeing right now is just a completely different picture. It's a completely different picture, and we just have to take that into account. I don't know. What are your thoughts on this?
I just think there's no reason for not doing RCTs right now. Like, I think you could give it. Like, if I'm just putting myself in what would be a situation where I'd want a fourth dose, and for me, it'd probably be I got severe immune compromised, elderly population potentially, but. The trials that we're doing are observational, or not. I shouldn't say trials. The studies that we're doing are observational. You compare those I got a fourth dose and outcomes with those I got a third dose, and it makes sense that if you see a benefit in the fourth dose people, that you would think, hey, then for sure I'm going to want a fourth dose. The issue is the people that got the fourth dose are not the same people that would got the third dose. Like the fourth dose people could be more careful, more vigilant group of folks. Yeah. You want to be able to do it randomized where you find people that are equal demographic, equal risk, and say, hey, you get a booster fourth dose and you don't, and then see the outcomes. Like we're at the stage now because of, once again, I think we're in a better spot than we've been in the past to really make formal evaluations and to be more sure of the science. But like I said, if just with the data that we have today, if I were in those high risk categories, I think I would take an extra dose. And
there's also, I think, we're seeing this waning effect that's happening. The fourth dose, if I'm not mistaken, it was waned. It was in the New England Journal paper. I think it's out of Israel, right? They showed waning at 3 to 8 weeks, which is even faster than it did with the third dose. And that makes you think that still might be something that you could use, but you might want to time it for a respiratory wave, right? So giving it now, you might be shooting the shot too early. right?
That's
Either way, you know what I'm saying? So either way, like, it really makes me uncomfortable that the fourth dose was something announced by the CEO of Pfizer, what's his name, Bourlas. And then all of a sudden, within a couple of weeks, it's now policy for 60 and above, everybody in the States. And, we kind of have been following suit in a lot of what they've been doing. So we're out of the phase. We're out of the emergency phase. Whatever type of policy that needs to be put in now, it should be done with good evidence.
Yeah, the bar has shifted because of the urgency in the earlier, but yeah, I think the standard should be high quality randomized controlled trials that dictate policy when we have time. And in my opinion, we have time to be more diligent to really have a firm grip on these questions. You know what I'm saying? Because
definitely.
Yeah. Any parting thoughts, remarks, anything that's been irking you that you want to get off your chest that I haven't been able to address, my friend?
I think that the big thing for me, and, you and I used to do a lot of media, like when in the months previous, I have not done a lot at all, especially since the Ukraine war, which obviously is a terrible thing. But in one sense that, this thing is something that was hyper focused on for 2 years. And the fact that the perspective is changing for different reasons, I do think that people have to remember that even when COVID's not something that's going to be in everyone's, front windshield, it's something that we're going to be dealing with in the medical field, in ICU, in, ID for years to come. And the thing is that at this point now, your individual choices aren't what's making a big difference in the wave, right? But I think the other thing is that for 2 years, we had the onus put on the population to kind of account for a structural defect that we had in our healthcare system. Obviously, this is not something that's going to be fixed quickly. But I do think that now, look, we did our thing. We have the vaccines. Now it's important to really kind of look deep and see what we can do in the short, medium, and long term to really fix these problems in the healthcare system to the best of our ability to be able to withstand these surges in the future. And listen, I'm not a health policy or health administration expert, but I do think that these solutions do exist and we should talk about them because, we're going to see other pandemics. And I really don't want us to have to go through this again, especially, the lockdown and the way that it caused all these, unintended harms that might last for, a long, long time to come.
100%. I just think there needs to be a focus on interventions over restrictions. I think we need to build capacity. I think we need to have an open mind to therapeutics and really reverse engineer how we approach COVID. Who lands in hospital? What do they need to prevent them from landing in hospital? Bring the therapy to them if you need it. Make it easily accessible. Whether that's monoclonals, whether that's Paxlovid, whatever it might be at the time, like vaccines at your door. Let's make it as simple as possible to protect the hospitals and build capacity but at the same time really had a focus on maintaining normal life because Sumon, I think you put it lightly that some of this impacts can be generational. I honestly think so, like the mental health, the education, especially for our kids, that that virtual learning was an atrocity as far as I'm concerned. It was too harmful for so many. But actually, there's one last thing I forgot to ask you about, and I'd be remiss not to bring this up. Fissman paper. Did you have any? Did you have any? So there's a paper that came out by Fissman. I always get this wrong a little bit, but basically saying that unvaccinated folks can really disproportionately spread COVID, especially to those that are vaccinated, based on his model. And this got a lot of press, way more press than I ever would have thought. I'm wondering if you have any thoughts towards the paper.
Yeah, I think the paper, it's the long and short of it is, I agree. I think that on first glance, says, oh, where's this coming from? And you look at it in the paper, you have to realize what this is. This is a model that was put together, and there were certain parameters that were entered that then kind of gave a result. And I think that some of these parameters, it didn't account for waning immunity. It didn't account for post-infection immunity. There was I think the vaccine efficacy for infection was put up I believe at 80%. There's a lot of things that I think were plugged in, which were not entirely correct. But the other thing to remember, this is a model. This is not real life. And I think that this type of paper, I think it really was kind of casting a negative, very divisive type of perspective on individuals who are unvaccinated. Look, I want people to get vaccinated, but I don't want to force anybody to do it. And I certainly don't want to shame people that didn't do it. The other thing is to remember, an unvaccinated person in 2022 is different than what we were seeing in a year ago, because look, we've had 2 massive Omicron waves. We've had a Delta wave. People have been exposed, and we can't be ignoring post-infection immunity. So I think that the bottom line is the paper was a model. I don't think it reflects real life. And I think that there's a lot of assumptions that went into it that were not correct. And the result, whatever it was, is not really applicable to the broader situation that we're seeing, which we really want to be dictated by evidence that's from, on the ground, real life situation.
Yeah, that's the only thing I'll add is that, to reinforce, I guess, is that I would like to see a model that reflects what we're seeing on the ground, not a hypothetical situation that is past us. And just because just from a societal point of view, I just think this takes us a step back. And so I was a little bit disappointed at how much it was picked up and how quickly conclusions were made about it. But we've seen a little bit of bite from the medical and scientific community in terms of this paper. So we'll see how it plays out, my friend.
Definitely.
Listen, as always, Sumon Chakrabarti, representing hard, yo. And I just want to thank you as always.
I'm still holding the record, the most visited guest on the show, right?
Yeah, man. By the time this comes out, it will probably be our 183rd episode-ish. And you've made at least 97 appearances. And so, yo, I want to thank you as always. You always represent well. Doing this live off the cuff too. I gotta give you mad props as always. Listen, folks, thanks for listening. We always appreciate any comments. You can find us at on Instagram, YouTube, TikTok, IG, Facebook, obviously. Follow us along there. Also leave your comments at quadcast99@gmail.com. We love you. We're changing the boogie. Check out Solvent Wellness. And everyone, I was going to say stay safe.
Everyone, have fun.
Have fun. Be joyous.
Hal Johnson and Joanne McLeod, keep fit and have fun.
Yeah, keep fit and have fun. Yeah, man. Oh, that's perfect.
Perfect words.
All right, folks. Thanks so much. Okay.